Hi everybody, thanks for being here at the Fall Health Fair. We're going to get started with our next presentation. I'd like to introduce Bill Drenik. Bill owns Washington Senior Resources, and he's going to talk to us about Medicare open enrollment, everything that goes along with that process. Thank you, Bill.
Thanks, Julie. Well, thanks for having me, everybody. Thanks for attending. As you can see, I'm a former high school teacher, so I'm going to keep an eye out for some of these gentlemen here. It might be troublemakers, because I've been used to that over many years. So, Medicare. There is a lot of changes coming up for Medicare in 2025. It's real important for people to understand this. Some of the plans are leaving. That means those people whose plans are leaving are going to need to have a new plan by the end of this year. Usually December 7th is when annual enrollment ends, from October 15th to December the 7th. However, if the plan is leaving you, then you have until the end of the year to do that. Now, I have a number of clients of mine who have not received letters from their insurance company yet. If you have not, I highly recommend that you give them a call and find out and have them send you the letter, or what we call an annual notice of change document. Every year you should get that. It tells you what is changing on your plan from one year to the next. Now, there's a number of companies. For example, Primera is leaving Washington State. So if you're on a Primera plan, you need to make a plan change. Should have received your letter, but I'm finding out a lot of my clients have not received their letters yet. And there are some other companies also that this is affecting. So we're going to get going here. We're going to do a brief overview of what Medicare is, just to remind everybody. So Part A, what is Part A? It's hospital stays, skilled nursing, inpatient health, home health care, and hospice. What it does not cover are physicians, personal care items, private hospital rooms, or custodial. That is under Part B, and Part B is your primary care physician, any specialist, any radiology services, any lab services, and those things fall under Part B. Now, this is original Medicare. These are not Medicare Advantage plans yet. We're going to get to that. So, if you are already in Part A and enrolling in Part B, let's say you're turning 65, you have 7 months to do that. The 3 months before your birthday month, and the 3 months after. Now, your plan will start your birthday month, the first of the birthday. So if your birthday is in July the 15th, your plan starts July 1st. However, don't ask me why this rule was put into place, but if your birthday is on the first of the month, your plan actually starts the month before that. Somebody must have, Medicare said, I'm going to make a change. I have to make a change to justify my job today. I'm going to make this rule. It makes no sense, but just be aware of that, because that can throw you off a month. Yes, sir.
How did that work on December 23rd? That's my birthday.
December 1st will be when your plan starts.
Okay, so I have to sign up by December 1st then.
You should actually sign up through Social Security for both A and B 3 months before. What happens is the system is on overload right now, Medicare and Social Security, especially after COVID. So it's always highly recommended to do it early. It's going to take you 4 to 6 weeks to get approved. So you don't want to do it the 1st of December, because it's going to take you into January. And if let's say you do it on December the 1st, you enroll because your birthday is on December the 23rd. What will happen is it's going to take 4 to 6 weeks. It's going to put you into January. And if you apply for a Medicare plan on the second day of the month, it's going to take you into the following month, even if you want to do it the first of the month. Yes, ma'am.
Yeah, we're federal. Now that's automatically for us, right?
Sorry, what is that?
We're federal. federal,
Federal?
retired federal employees, so that's automatic. We don't have to sign up.
You should have to sign up anyway. You should call out Social Security and make sure that you're aware that you have to enroll into Part B. You already have Part A at when you turn 65, but you will have to enroll in Part B even if you have a federal program. So you should call Social Security or call your benefits department and at the your federal plan and ask them about that.
We've been on it for a long time. We've never had any problem.
Do you have Part B?
Yes.
Okay, so you're set. You already have, yeah. Yes, ma'am.
So we got the card that says A and B automatically. Do I still need to call and sign up?
No, you don't. That means you've applied for Social Security benefits, right?
Yes.
Yeah, you will automatically be enrolled in A and B.
So automatically enrolled in A and B.
Yeah, good question. Yeah. Okay. Okay. Then if you miss that window, you can enroll from January 1st through March 31st. But you may end up with a late enrollment penalty for not having it. Okay? And that is 10% of what the Part B premium would be, and it's a lifetime penalty, so you don't want to miss that opportunity.
Even if they screw up, you can't get it fixed. I know this.
That's right. You have to be proactive. Don't assume anything. Call Medicare, call Social Security. If you're turning 65, do it 3 months before and say, I want to enroll into A and B because I need a Medicare plan. Now, if you're on an employer plan, your spouse is still working or you're still working and you have an employer plan, you don't have to enroll into Part B until you're ready to move off that plan.
So the question is, where should people apply for Social Security? Should they call, which can be a long wait?
Mm-hmm.
Should they try to make an appointment at the Tacoma office? Should they live here in the Key Peninsula? Should they go to Kitsap County and go to their office? Because perhaps the waiting list is not as long.
Right. Best thing is, if you can, is enroll online at ssa.gov.
But some people can't.
Some people can't. You need to give a call into your Social Security, have them send you an application. You can fill it out and send it in. You can go into the office and sit and wait if you want. It's your option. But never procrastinate on this. It's very important because you can run into some penalties later on. Okay. Part B premiums. For this year, it's $174.70 if your income falls under this amount here. So if you're married and you're making less than $206,000, then your premium would be $174.70. As you see here, if you're making more than that, then your premium will go up. They call it income-related monthly adjusted amount, IRMA, and this is it here. So you'll pay this amount here over and above the $174.70, what brings it to here. Now, I have a number of my clients that find out that my Part B premium is actually $244. Why is that? Well, they go back 2 years on your tax returns to see what your income was. So, well, I didn't make that much money. If you sold a rental and that was income, they will apply that. I have some physicians, I have some attorneys who made good money throughout their career, and 2 years back their income was more than this. What I tell them to do is there is a form called an SSA 44. It's a life-changing event. You're retiring, you're not making that money anymore. They will adjust it down. So it's really important for those that are making a little bit more money. Part B, as I mentioned, here's what it covers. So we're still on original Medicare, your red, white, and blue card. So you're not going to get these benefits through Medicare. You're also not going to get prescription drug coverage. Medicare does not offer prescription drug coverage. You have to do that through a private insurance company. So you can still have your red, white, and blue card, and you will then have to enroll into a prescription drug plan on the side. If you don't enroll into that prescription drug plan, you're going to get a penalty. I'll give you an example. About 5 years ago, I had a gentleman call me and he said, my buddy is your client. And my doctor just prescribed me a cholesterol medication. And I want to enroll into a plan. And I said, well, how old are you? He goes, I'm 72. Healthy guy, never took prescriptions. And I said, well, you have a Medicare, what plan are you on? He goes, well, Medicare. I said, A and B? Yeah, my red, white, and blue card. When I go to the doctor, that's what I give him. I said, okay, no prescription drug coverage. And he said, why do I need prescription drug coverage? I don't take medications until now. Perfectly reasonable question to ask. Well, because now you have a penalty because you didn't have prescription drug coverage. For 7 years, he didn't have it. So he said, how much is that going to cost me? And in my head, I said, well, over 7 years, it probably, at that time, I said between $25 and $35 a month, every month for the rest of your life. He said, you're kidding me. How do I find out? I said, call Medicare and they'll calculate that for you. Well, he called me back a couple of days later and said, I found out my penalty is $27.50. So what do I do? And I said, well, you have some options. You don't need to do anything. You know, a prescription drug that is a tier 1 medication or a tier 2 medication, it might cost you $10 retail at the pharmacy. You can buy it over the counter. You don't have a penalty because you haven't enrolled into a prescription drug plan. It's when you enroll into it, as they say, okay, you've got so many years, now you've got this penalty. Well, he said, well, what do I do? And I said, well, I'm not going to tell you what to do, but those are your options. Is to just purchase it retail or enroll into a Medicare Advantage plan that has a 0 monthly premium, that has prescription drug coverage. You get on that plan, their tier 1 medication is going to cost you nothing. So, but now you have this penalty. He goes, well, what do you think I should do? And I said, well, the only concern I would have is what if 5 years from now your doctor says, hey, Bob, you've got COPD and you need an inhaler. And retail costs on those are like $350 a month. And your penalty is going to be even higher 5 years down the road because every year it adds up. So he said, well, I think what I'll do is I'll go ahead and eat the $27.50 every month, get onto a plan. I get my medication for free. That saves me $10. So I'm kind of paying $17.50 a month now for my, for that medication. And that's what he ended up doing. So even though you're not taking medications, you should be on a prescription drug plan for a number of reasons. First of all, medications are very expensive if you don't have coverage. And number two, it will eliminate any penalty that you might have down the road. Okay. So Part B costs, a $240 deductible, and then you have 20% co-insurance. So you go to the doctor and you're going to pay 20% of the cost of that visit. Now you're still on original Medicare, yeah, Neil.
You want to differentiate between co-insurance and
Co-payment. Yeah, co-insurance is a percentage, and with Medicare it's always kind of an 80-20 split. They'll pick up 80, you pick up 20. Co-payment is a little bit different. It's a predictable cost. It's $15 to go see your primary care doctor. Maybe it's $45 to see a specialist. That's a co-payment. Predictable costs are nice. When you're talking about 20%, well, 20% of what? You don't know until you get the bill. So, good question there, Neil. There is no maximum out-of-pocket cost with Medicare. On Medicare Advantage plans, you will notice that there is they call it a MOOP, maximum out-of-pocket cost. And on most Medicare Advantage plans, they will range from $6,000 to $7,000. That's the most you're responsible for medical costs for the year. Should you ever reach it, you pay nothing more. Less than 2% of people reach their maximum out-of-pocket. Why is that? Well, what is the one thing that people are most concerned about, cost-wise? What is it going to cost me to go to the hospital if I'm in a car accident? Well, on Medicare Advantage plans, I always like to give averages. On your plan, you may have a $400 per night responsibility for a hospital stay, but you're only responsible for 5 nights. So what is that? That's $2,000. If you're in past 5 nights, you pay nothing. You're in that car accident and you're in the hospital for 30 days, what's your cost? $2,000. What if you're in for 6 months? $2,000. Now, what will happen is that $2,000 is applied to your maximum out of pocket. So it's $6,000 is your maximum out of pocket. Now you're responsible for $4,000 more. Well, you would have to go to the hospital for 5 nights, maybe multiple times, or you have a lot of chemotherapy, you have a lot of radiology services. Those things can add up. You can reach the maximum out of pocket, you pay nothing more than that. Okay, any questions about that? So, this is why most people have gone to Medicare Advantage plans, because you have some protection. So if you're in the hospital, so you're in the hospital for, 9 months, you can imagine what your hospital bill is going to be if you're paying 20%. So, very important that people understand that. Medicare was established when? 1964 during the Johnson administration. When were Medicare Advantage plans established? In 1996 during the Clinton administration. When were prescription drug plans established? That was during the Bush administration in 2006. So you can see kind of a progression there. Before 2006, you were responsible for your medications. Now, at 2006, they have prescription drug plans that help to protect you. And we're going to get into now 2025 later on of how that's even escalated more to more benefits. So you're not retiring at 65. You should verify with your employer. You would know yourself how many employees. I don't know why this rule is such, but if you're in a company that has less than 20 employees and you have insurance with them, you need to enroll in Part B. If you have more than 20 employees, then no, you do not have to. I always tell people, if you're going to continue to work past 65, talk to your benefits department, get it in writing from them what your responsibility is. And then you have up to 8 months after you retire to enroll into Part B. I don't know why anybody would want to wait past this month to get it done. So what you would want to do, you're going to retire in June next year. Okay, when do I enroll in Part B? March, April, May. Very good. Who said that? That was very smart. That was sharp. March, 3 months before. Because you want it to start on the day that you're losing your coverage, you want your plan to start. You don't want a gap in coverage. Heaven forbid you do that and then you find out that you've got this huge bill because you got to go to the doctor, you need radiology services, whatever it might be. Okay. And let's go back to this right here. HSS health savings accounts. A lot of people have HSAs, they're called, with your plan. Well, you no longer can contribute to an HSA if you enroll into both Medicare A and B. Okay. Medicare Supplement or Medigap plans. They're a little different from Medicare Advantage. We're going to start with this. A supplement plan is a little more expensive than Medicare Advantage plans. And a most comprehensive plan is a Plan G, they call it, and it runs around $200 a month. So a supplement plan, you can see any physician in the country who accepts Medicare. If you move out of state, that plan goes with you. You never lose it. The other thing is there's no referrals, no prior authorizations when you go to the doctor. So right now, And I should say that supplement plans do not cover prescription drug plans. So if you have a supplement plan, you need to have what we call a standalone prescription drug plan to cover your medications. So there'll be a cost to that as well. Pardon me?
Medicare D.
Part D, that is correct. And here it is right here. And there's no health questions when you first become eligible to enroll in the plan. Well, when do you first become eligible? When you turn 65 or when you retire. You might retire at 72 years old. You still have the ability to enroll in this plan without any health questions. If you enroll into a Medicare Advantage plan first, and let's say 2 years later you want to go to a supplement plan because now you have a lot of medical expenses, they're going to ask you health questions and you can be denied, and most likely you will be. So, the reason I bring this up here also, yes, it is a little pricey, but if you are in a Medicare Advantage plan right now, let's say with Primera, that's leaving the state, you have an opportunity to enroll into one of these plans without any health questions. And I have some clients that have a lot of health issues that were on Primera, and they said, absolutely, I want to go to a supplement plan because my expenses are far higher than what the premiums are. Okay? So, Medicare supplement plans, there's every company has a different plan, but they go from A to N, but they're standardized. So a plan G, let's say, on one company is a plan G on another company. No different except for the monthly premium. Okay, let's move along. Here are the different supplement plans. You'll notice Plan G covers just about everything. Where are we here? Except for the Part B deductible. Plan F is no longer available to people who turn 65 after 2010. Is it 2010? 2020. 2020. So,
Plan G covers everything except for what?
Plan G covers everything except for your Part B deductible is $240. So with Plan G, you've got your, let's say it's $200 a month. That's $2,400 a year premium. Whether you use it or not, that's your cost. That's your medical cost plus the deductible of $240.
That's for Plan A and B.
That's for Plan G. Plan G. You have your A and B. In order to enroll into a Medicare plan of any type, you have to have A and B.
That's mandatory. They take it out of your Social Security.
Exactly. You're still going to have your Part B premium on top of that, no matter what type of plan you're on.
And Plan G covers everything except for $240.
That is correct.
Covers all medications and everything?
Not medications, but all medical services.
Okay.
You have to have a prescription drug plan on the side. It's called a standalone prescription drug plan.
So, Bill, if someone has been on an Advantage plan, the plan leaves the state,
Mm-hmm.
does that person who has been on Medicare for many years, can that person go to Plan F?
They cannot unless they're turned 65. I thought it was.
Well, that's my question.
Yeah.
So, this person, let's say, turned 65 20 years ago.
Yeah, if they're before that, yes, they're still they're grandfathered in.
But can a
It's
person
2010.
who turned 65 20 years ago, has been on Advantage plans,
Mm-hmm.
wants to go to a Medicare or supplement plan, can that person, because of course it covers a lot more stuff, can
Mhm.
that person go to F?
They can.
They can.
Yes.
Okay.
So what's the difference in Plan G and Plan C?
Well, you can see here.
I can't.
Oh, I'm sorry. So C here, you've got excess charges that aren't covered. With Plan G, there are. With Medicare supplement plans, they can charge you a 50% excess charge on any services. So with a Plan G, you're not responsible for that.
Like a service fee type of thing?
It's like a service fee of some, yeah, they can charge you up to 15% over and above what they bill.
What are the rates
But
like?
I think the question, that comment here was that your F is no longer available. If you're on an Advantage plan and you want to switch to F, you cannot switch to
Well,
F.
you know,
You
that's a
would
good,
have to go to
that's
G.
a good question, and I'm not sure if you can either. If you're, let's say you're on a retirement,
Point.
Yeah,
if you're,
Especially since my Advantage
Yeah.
plan
Yeah.
is leaving,
yeah.
so I do have the option of going to a supplement plan.
Oh, you do?
Yes,
'Cause
that's
Yeah.
that's one of the big changes for 2025.
Okay.
So, this person, or I can use myself as
Yeah.
an example, I turned 65 15 years ago.
Right,
So, in that respect, I'm grandfathered in.
right.
Can I go to Plan F?
I don't know.
Well, that's,
yeah. See, these rules, this year, things are changing a little bit because of the way that it's designed. But if, let's say you're on a retirement plan right now, and you turn 65 before, I think it's 2010, and you want to go to a Plan F, you can, because you're grandfathered in because you turned 65 before 2010. Once you turn 65 after, anybody turns 65 after 2010, then you cannot enroll into a Plan F. And I would tell you, it would be usually a mistake to do that anyway, because the premium above a Plan G to a Plan F
it's much higher.
is much higher than the deductible.
Yeah, I figured that.
Yeah, so very, very few people would want to go to a Plan F.
What is the premium for Plan G?
Part G, Plan G,
Yeah.
it's around 200 plus. There are different companies have different premiums, but let's just say around 200 plus a month. Yeah,
But that's for a standard Medicare plus supplement. And the other issue with Advantage plans, you might be saying, is it's hard to switch from an Advantage plan to a
Sup-
standard Medicare and a Medigap.
yes. And if you, it is, well, you can apply, but you're probably going to be denied.
Right.
Because why would you want to do that? Because your medical costs are more expensive than what it would be to be on
Right.
a plan that costs you $2,400 a year. Your medical costs are, let's say, $4,000 a year. Or you reach their maximum out of pocket of $6,000 or $7,000 in Medicare Advantage. But yeah, I want to go to a supplement plan because it's only $2,400 a year. But they can deny you. And I've had many clients try it. I said, well, let's apply.
Yeah.
Tell them, I don't know if you're going to be approved, and I'm pretty sure they're not, but I want them to go through the process themselves to actually see that.
The other point I want to make is supplement and Medigap, two different names for the same thing.
Same thing.
Right.
Yeah, supplement and Medigap, same thing. Yes, ma'am.
So you pay your $200 a month, so that's what, $2,400. Then you have to pay your $2,800
No.
out of pocket. What's the deductible?
Your deductible, as I said, 174. Well, the deductible is 240.
That's fine print. Plan F and G after you pay for the Medicare.
Oh, that's a different plan.
Yeah, there's high deductible plans. It gets really confusing. Yeah, there's a high deductible plan where the premium is less, but you've got a $2,000 deductible right off the bat if you go to the hospital for one night or whatever.
Yeah, so there's different plans.
Yes.
A plan and
Yeah.
B, they're all different. But G, if you're not eligible for F, is the most comprehensive of the Medigap plans. But then you will probably pay a higher monthly premium. And I hope I have that all right.
Yes.
That's, as I understand it, I'm pretty knowledgeable about Medicare.
Yeah,
And, you're probably gonna get to Advantage plans.
yeah, we're going to do that next. Yeah, let's get to that. So here is Medicare Advantage, which most people, about 95% of people are on Medicare Advantage plans. Why? They're more cost effective. You know, you can budget for it. You know, you don't have to they start at $0 per month and go up from there. So what is a Medicare Advantage plan? You have to have Part A and B. And it also Many of them offer prescription drugs. About 90% of them do offer prescription drug coverage within the plan. And also have additional benefits like dental, vision, hearing, gym memberships, over-the-counter products. That is, we call those ancillary benefits. Those are going to be changing next year, however, on many plans. So a Medicare Advantage plan could or could not cover prescription drugs. Well, why wouldn't somebody want prescription drug coverage in their Medicare Advantage plan? Well, if they're a veteran and they go to the VA to get their meds, they don't need to.
You can do that?
Yes.
Oh, I'm gonna do that.
Yeah, those are plans that don't have prescription drug coverage. But they might say, well, I want prescription drug coverage in my Medicare Advantage plan anyway. Veterans is the only group of people that can have 2 prescription drug plans at a time, the VA and a Medicare Advantage plan. Nobody else can. So if you have a Medicare Advantage plan, I've had this happen before, and people during the year see something in the mail, prescription drug plan, you know, very inexpensive. Well, maybe I'll get it because now I've got additional coverage just in case I have some medications that aren't covered on my plan. Big mistake, because now Medicare will say, okay, you've got a prescription drug plan, we're disenrolling you from your Medicare Advantage plan. Now you don't have you don't have coverage under Medicare Advantage. So it gets very complicated.
So how do you know if Medicare Advantage is, that's above and beyond Plan G, right?
No, Medicare, there's Medicare Advantage plans and there's supplement, also called Medigap plans. This is different from this.
How do you know if it covers your medication?
Well, your agent's supposed to do that for you. That's what, with a supplement plan, now as we mentioned, you have to have a standalone prescription drug plan. There are, I think this year, there's 24 prescription drug plans. And
Different than Medicare or something?
it's,
Different than this?
yes, because supplements do not cover medications.
Gotcha.
So you need to have what we call a standalone. So you've got 2 plans. With a Medicare Advantage plan, you can have it all wrapped up in one. You've got your prescriptions inside your Medicare Advantage plan.
Okay, that's what I was asking.
I know it's confusing.
Really?
Yeah, really. Yeah. Just wait.
Why did you get it when we were 20-some years old, go Chris?
But if you have a Medicare Advantage plan that includes the drug coverage and you go to the VA to get them because it's too high, they won't drop you.
No, they won't drop you.
Okay.
No. You can have VA benefits with prescription coverage and a Medicare Advantage plan. Most people will say, well, I've already got my meds covered with my VA, so I want to go on a plan that doesn't have prescription drug coverage. Well, what type of plans are those? Well, usually what's going to happen, you're going to find out, since the plan doesn't have to pay for prescriptions, your ancillary benefits, dental, vision, hearing, that type of thing, are a little more robust. So you always compare those, okay? You might get more dental on a plan that doesn't have prescription drug coverage, and say VA might not have dental coverage. This is why it'd be good to be on a Medicare Advantage plan also. Okay, there's different types of Medicare Advantage plans. Health maintenance organizations, that is a network of doctors that you have to go to for services, okay? In Pierce County, usually the networks are quite large. You've got Franciscan, Virginia Mason, and Multicare, and a lot of independents. So usually what I tell people, if you want to go with an HMO, we'll just make sure all your doctors are covered. And if you need a specialist, you're going to be able to find one within the network. Most of these plans, some of the plans have over 20,000 physicians in the network. So certainly you're going to find a doctor if you need one. A PPO is very similar to an HMO. There's a network of doctors. However, you can go outside that network, but you're going to have a cost share over and above. And usually it's going to be around 50% of that cost of that visit to a specialist, somebody outside the network. So I just tell my clients, we can do that, but don't do it because you want to go outside the network. Let's make sure For example, some people might say, I want to go to Seattle Cancer Care Alliance because my mom was there and they took great care of her. Okay, well, do you want to go to Cancer Care Alliance and pay 50% of the cost of that service? Probably not. Let's make sure you're in an HMO plan where Seattle Cancer Care Alliance is in the network, so you can go if you need to. Yes, sir.
But HMO, you gotta have a referral for every time you wanna go somewhere, so you gotta make another.
Yes and no. More and more plans are not requiring referrals now. But yes, some plans still do. Good question. Good comment there. You're still going to need to have a prior authorization. You're going to have surgery. You need to get that approved before you can do that. So you just can't go get surgery done without a prior authorization from the company. And what is that process? Well, your doctor will be sending in medical records justifying why you need that. And it'll probably could take 10 days to get that approved. Special needs plans. Similar to an HMO, but really limited to people who are on Medicare and Medicaid. They're a little bit different plans. So you have to have Medicare and Medicaid. And depending on your level of Medicaid will depend on what type of a dual special needs plan you can enroll into. Prescription drug coverage. Okay, like I said.
Completely separate from everything.
Pardon me?
Completely separate from everything?
Dual special needs plans? Well, they're like...
No, prescription drugs.
Yeah, well, prescription drugs, like we talked about, if you have a supplement plan, you need to have a prescription drug plan if you want coverage. If you don't, then later on you enroll in one, you've got a penalty. With Medicare Advantage plans, they're already included inside the plan. So we're still, we're assuming that you're on a just Medicare A and B, original Medicare. And they're offered by private companies, approved by Medicare. It's voluntary, you don't need to enroll into it, but like we said, a 1% penalty based on the base beneficiary premium every month without having drug coverage. And every year that amount goes up little by little. So what covers? It's all outpatient prescriptions. Part D covers medications you get at the pharmacy. Now, some people get injections or infusions in a clinic. That falls under Part B as in boy, and you're going to pay 20% of that. So when we're talking about prescription drug coverage Part D, these are the medications that you're prescribed by your doctor that you get through a pharmacy or mail order. Outpatient drugs, prescription covered in a formulary. Every drug, this is why it's important to understand why there's so many prescription drug plans. Because every plan has a different list of drugs they cover. It's called a drug formulary. So when you go looking for one, you want to make sure, you need to find the plans that cover all of your medications. You don't want to just get a plan, well, this plan has a lower premium, so this is the plan I want. No. Make sure all your medications are covered. And then of those plans that cover all your medications, what we'll do is we'll determine, based on the premium and the cost of your meds, the lowest cost plan that includes premium plus cost of meds, that's a plan we would enroll you into of the 24 plans that are out there. So there's a process involved there.
Can I suggest?
Yes.
And you can do that online.
You can do that?
So if you
Yeah.
are good with the computer and you can do your Medicare B application, you can also go into that site and put all your medications in there. There's a whole really easy to do in the Social Security Medicare.
Do they send them to you then? Can you request to have the medicine sent?
No, it's not to cut, it's for you to get the information to select the best plan for you.
Yeah, what you would do is you would go to...
enter all your meds in and the dosages and everything, and then it will give you the option.
You go to Medicare.gov.
Great. Okay.
Medicare.gov is what you go into. and you can put in your medications. Make sure you got the dosages right, how many times per day you take it. It's all in there, and it'll give you your plan options.
And I do it every single year. Because you could be taking the same meds, and you enter your meds in, and you'll get a different answer, and a different plan might be the best plan.
So we don't see
Yeah.
that any problem.
Yeah.
Okay, question.
If you you have a plan and then you get put on another a med that is not covered by that plan,
Mm-hmm.
do you then at open enrollment time go change your?
Yes.
Okay,
However,
so you just have to bite it for the rest of the year.
you do have an appeal here process, an exception or an appeal. So that does happen. The question was, I've got my plan and my doctor prescribes me a medication, but my plan doesn't cover it. Then what? Well, you can ask for an exception through the plan to get that covered, but it's going to be at a higher cost. But then what you're going to do, and that's important, what you're saying, is every year you need to have your medications covered. My medication's still covered next year on my plan, because a medication covered one year on your plan might not be covered next year. So it's important to do that.
And also pharmacies, because sometimes one pharmacy will not be on that plan, but another pharmacy.
Well, it could be on the
You have to
plan,
check through
but
all
it could be there's preferred pharmacies and standard pharmacies. So there's going to be a cost difference depending on if the plan has a contract with that pharmacy. And that's how you can determine it. Sometimes mail order is not the lowest cost either. Yes, sir.
I'm just wondering if you could go back to your doctor and have them pick an analogous med from your formulary.
You can do that. You can say, because what happens sometimes is, and that's a great question, because you could be prescribed a brand name drug that could be costing you, let's say $47 a month on your plan, but that there's a generic that might work just as well. And you can ask the doctor, can I go on the generic that costs maybe nothing or $12 a month? Because I want to save on my costs, I want to try that first. And that's another thing the plans will do, they call it step therapy, is you have a medication, like you said, that's a higher tier drug. There's 5 different tiers of drugs. The higher the tier, the more expensive. And the plan might say, you know what, Bob, we have a generic that's less expensive. We want you to try on that. And if it works for you, fine. If not, then they will approve the higher cost tier drug. It's a good point.
So the plan right before this, the,
Supplements?
yeah, does that cover, some of those will cover prescriptions?
No, none of them do.
No, only prescription covered prescription.
Yeah. Supplements only cover medical expenses. So what is not covered? Drugs not in the formulary, excluded by Medicare, over-the-counter medications, and medications covered purchased outside the United States are not covered by Medicare or by your plan. Part D coverage options, we talked about the standalone. So what kind of a plan would you enroll into a standalone? A supplement or a Medigap plan, right? And like Neil said, supplement / Medigap. Some people say I'm on a Medigap plan. Some people say I'm on a supplement plan. It's the same thing, just two different descriptions for it. Medicare Advantage plans and certain Medicare Advantage only plans plus a PDP. Those aren't available in Washington State, but they are outside. So we don't want to even get into that. Part D premiums. Now this is also, we talked about IRMA. Where's IRMA? Right here. Income related monthly amount. If your income is higher, you can have a higher monthly premium or adjusted amount, similar to what you have to do with Part B. We talked about that earlier. So if your income is higher, you might be paying a little bit more for your premium. So deciding on coverage, you have A and B. You can enroll in a Part D standalone and a supplement or Medigap plan. Okay, these go together here. You can't have a Part D and a Part C Medicare Advantage plan that has prescriptions in it, or any Medicare Advantage plan. If you have a Medicare Advantage plan, your prescription drug coverage has to be within the plan. You can't have one outside the plan, okay? If you do, as I said, they will take you off, they will eliminate your Medicare Advantage plan and you'll lose that. Now, Part C, and most of the time, Part D is included in it. We talked about that. Veterans don't necessarily have to worry about that. If they have VA benefits, they can also go without Part D. Okay. Part A or Part B only, you can enroll into a Part D prescription drug plan, but this is, original Medicare A and B or Part B only. You can enroll into Part D. Cannot roll into a Medicare Advantage plan with a prescription drug plan. If you enroll in a Medicare Advantage plan, you cannot be sold or use a Medicare supplement plan. So you can't have a Medicare Advantage plan and a supplement plan. It's one or the other. Okay. Inflation Reduction Act. Okay, this is, we're getting into what's changing for 2025. Everybody's heard about the Inflation Reduction Act, right? In the news. Well, what is it? It has capped we call it a true out-of-pocket cost for you for your medications. It includes your deductible plus the cost of your medications. Once it reaches $2,000, you pay nothing more for the rest of the year. That's a good thing for a lot of people. I have a lot of clients that pay a lot more than $2,000 for their medications, as high as $7,000 or $8,000 a year. This benefits them greatly, as you can see. So anybody that has medications, you're never going to pay more than $2,000 for your medications starting in 2025.
Donut hole.
What's that?
No donut hole.
No donut hole. No catastrophic coverage, as they call that anymore. And we're going to get into that a little bit here. Yes, question?
So the max out of pocket, it's only on their tiered drugs, because one of our drugs is not on there, and so it went over the 2,000.
Anything that's covered by Medicare.
Yeah.
That's right. So if you have a medication that's not covered by Medicare, it's not going to cost. It's not going to work towards this. So.
It was almost too good to be true.
Yes. So eliminate the gap, as you mentioned. There's no donut hole or the gap. It's the same thing. Now, limits benefit premiums increase by 6% per year from year to year. So you get a premium, it's going to only be able to be increased by 6% by the insurance companies. Lower cost prescriptions. Certain vaccines are no cost. And there are negotiated prices for some of the at lower cost for many of the medications. And expand financial assistance, raise the full extra help limit to 150% of a limit for your income. Now, one thing that's important also to know, which is good, is deductibles for prescription drug plans can be as high, I think they're going up to $590 this year. So you go to the pharmacy and you've got a tier 3 medication, you've got a $590 deductible, and you've got your copay for your tier 3 medication, let's say it's $45. So that runs quite high, over $600 for January. Well, what Medicare is allowing you to do, and if you have medications that are expensive and you're going to you're going to have a deductible, call your plan, and what will happen is you can spread out those costs over every month of the year. So you don't have to pay that $600 and so on dollars in January for your other plans to start. No. All your cost is, let's say your cost is going to be $2,000. That's what's projected. That will be parceled out by month throughout the year. So what you want to do is call your plan in January and say, I want to be able to pay for my medications throughout the year, and they call it smoothing the cost out.
So you're making payments on your deductible, basically.
You can pay, your deductible can be spread out as well.
Okay.
So whatever your cost is, your cost of medications and your deductibles included in that, you can spread that out over 12 months. So you have equal monthly payments. You don't, here, let's see here. Here it is right here. Medicare Prescription Drug Payment Plan, also known as smoothing. That's where you pay the same amount every month, so you're not hit hard early in the year like a lot of people have been.
The one that I was looking at, it was tiered. It started out at like 6, and then it was another 6, and then it went to 3. So it had me paying it off in 5 months.
Well, you could you can pick a different plan if you wanted to, or the way payment plan, the way you want to. You can pay it all off at the beginning of the year if you wanted to. It's just up to you. So what is leaving is the current benefit design for prescription drugs, the coverage limit, the coverage gap, otherwise known as the donut hole, and the coverage gap discount program. So what we're going to have is the new benefit design, $2,000 maximum out of pocket. Also, there will be some manufacturer discounts in there, and manufacturer discount program versus non-applicable drugs, which would be those that aren't covered. And we talked about smoothing. How are we doing on time?
You got 5 minutes.
5 minutes, oh boy, okay.
Actually, you got longer than that. So
Okay,
you're all right.
okay.
Okay.
Just let me know. Throw something at me if I'm going over. So here you have your $590 deductible. It doesn't mean that your plan is going to have a $590 deductible, but they're allowed to be able to charge that amount. You're true out of pocket. After that, you pay nothing. So what is this right here? Then your plan pays 60% of the cost over and above that $2,000. So the insurance companies are taking a big hit. So that's good for people with expensive meds. However, if you're not taking a lot of expensive medications, what has happened with the rest of the Medicare Advantage plans? We call them ancillary benefits. Dental, vision, hearing, over-the-counter products, all of those are being eliminated on some plans or reduced substantially because the company has to pay that 60% of the medications over and above the $2,000. Now, I don't know if that has anything to do with the reason some of the plans are just getting out of Medicare. There's a lot of factors involved in that. You know, what they're getting paid from Medicare, et cetera, if they can stay in business. But I've had a lot of clients that they look at their annual notice of change document. You should have received it at your home, or either by email or by mail. And you'll see on that document, it tells you what your benefit was for 2024, and what it's going to be for 2025, and the cost differences, or what's been eliminated. And if a lot of clients say, well, geez, I can't get over the counter anymore. I got a lot of over the counter products. Now I see that my co-pays are going up to go see my doctor now. You know, I want a different plan. And I said, well, we could take a look at that, but you're going to find out that this is pretty much across the board, that all Medicare Advantage plans are going to be affected as far as those ancillary benefits. And maybe some now are having a premium where they had a 0 premium last year. Next year they're having a monthly premium. So be aware of that. Look at your annual notice, called an ANOC, Annual Notice of Changes document. You should have it at home. If you didn't get it, call your plan and say, I want you to send me my annual notice of change document. I didn't receive it. So we've got plenty of time. We're just starting. October 15th is when people can start to make plan changes, and it ends December 7th. Unless they have, their plan is leaving, they have till the end of December. If your plan is not leaving, you actually have what we call open enrollment. Annual enrollment is October 15th through December the 7th. open enrollment now. Medicare just started this 2 years ago. You have from January 1st through March 31st, one more opportunity to make a plan change. And that was a good thing for people who didn't have their plan reviewed, went to the pharmacy in January, and the physician says, well, your inhaler's $350. Whoa, wait a second. I paid $35 last year on my plan. Well, it's not covered anymore. So now you can go ahead and make a plan change in January when you find that, and your new plan will start in February. If you do it in February, it starts in March. If you do it in March, it starts in April. If you don't do it by March 31st, you're in lock-in for the rest of the year. Okay. So you pay nothing at the pharmacy now when you go get your medications. You will be billed monthly from your carrier, your insurance company. Your plan will be billing you monthly for your medications, and that's when you want to, like I said, the first of the year, unless you have very inexpensive medications, you'll want to have those costs spread out evenly throughout the year. It's much easier to manage. I'm sorry, was there a question? Oh. Okay, this is Medicaid and Part D assistance. These are people on, they're called dual eligibles, Medicare and Medicaid. We won't get into too much detail here, but also known as extra help. Some people will get some prescription drug costs reduced because they're considered LIS. Part C and D enrollment periods, talked about this briefly. When you first become eligible, usually around your 65th birthday, you've got 3 months before your birthday month, and the 3 months after your birthday month to enroll into a plan. But you don't want to really wait 3 months later. You want to make sure you have coverage. Do it early. We talked about annual enrollment, October 15th through December the 7th. And may add, drop, or switch Medicare Advantage plans or prescription drug plans annually. If you're on a prescription drug plan, you have to make that change. A standalone prescription drug plan must be changed before December 7th. If you have a Medicare Advantage plan, you still have another. This right here is applicable to the last application received by December 7th will provide coverage January 31st or 31st for plan termination. So this is called, we would call a special election period if your plan is leaving. Special enrollment periods, what does that mean? You move from Washington to Idaho, let's say, in the middle of the year. Well, what do? Well, you've got what we call a special election period to enroll into a Medicare plan in your new location, okay? Involuntary loss of credible coverage. There's a lot of reasons why you might have a special election period. Gaining or losing Medicaid eligibility. Retiring in the middle of the year. You have employer coverage, but you're retiring. Well, you don't have to wait till annual enrollment in October. You want to be able to enroll into a Medicare plan when your employer plan is leaving, so you don't have a gap. Okay, January Medicare Advantage open enrollment. We talked about this briefly. January 1st through March 31st. So if you don't do it during annual enrollment, October 15th to December 7th, you have another opportunity in January, February, or March to make a plan change, if your plan is still available to you. If it is,
renew every year?
You do not. You do not need to renew every year unless we do a report and find out that maybe your medications aren't covered, or your doctor is not contracted with that plan anymore. That's when you want to make a change. If I do plan reviews for my clients every year. Send me your list of medications and doctors. Well, nothing's changed, Bill. I said, send me your doctors and your medications. I'll do a free plan review for you to make sure that your meds are still going to be covered next year and your doctors are still contracted with your plan. Okay.
You selling insurance, or what do you do?
I am a broker, yes. I represent, this year it's going to be 8 to 10 plans or companies and their plans. And I do reviews for people. Just to confirm, if nothing else, I'll find out from my clients, look, your meds and doctors, they tell me I like my plan. I just want to make sure my meds and doctors are covered for next year. Okay, we'll do that. We'll say, yes, they are. You don't need to do anything. It rolls into next year. You don't need to renew. It just goes right in. I have some people who are on the same plan for the last 8 or 9 years. Some even longer than that. Just as long as their plan is still available to them and their doctors and meds are covered, there's no reason to make a plan change unless, they might say, well, you know what, I would like to get more dental than I have this year because I've got some issues. We can look at that and maybe find a plan that covers your meds and doctors and also better dental.
So what do you sell all these different
Yeah,
brokers for all these different?
yeah,
Okay.
yeah,
So I could go to you and say, I'm just getting signed up, and you could figure it all out.
right.
Okay.
And we have a discussion about when are you going to be turning 65 or when are you retiring. You need to do that at least 3 months, 4 months, sometimes I'd say 4 months before. So I can give you kind of an idea. You're going to give me kind of an idea of what are your needs, beyond doctors and medications. I need hearing aids. That would be good to know because hearing aids on one plan might be better than hearing aids on another plan. And if the doctors and medications are covered there, that's probably the plan you want for this year. Next year, you might want to change it again because your needs change. Okay. Okay. Yeah, so you can see here there's a number of things you can do. You can enroll into or apply for a supplement plan, but medical underwriting is going to be requested. And that is medical underwriting means they're going to ask you health questions. You're going to be denied. Okay. And that is it. Any more questions? So, the takeaway today is to take a look at your annual notice of change document at home. See if your plan is changing. See what is changing on it, what you're losing this year. Now, that doesn't mean what you're losing this year isn't going to, same thing is going to be lost on other plans that might fit your meds and doctors, but that's something we certainly take a look at. And I'll show you. I have people all the time tell me, well, Bill, what plan do you think I should enroll into? I said, nope. I'm educating you. Here's your options. Here's the 2 plans, both of these plans cover your doctors and your meds. You're going to look through there and you're going to say, okay, well, labs are less expensive here. I go to labs quite often. Okay, well, maybe that's save you a few dollars here or there. Or it might be dental's a little different. Maybe it's a gym membership. Maybe somebody wants to go to the YMCA. Some plans cover the YMCA. Others cover what they call silver sneakers, which does not include the YMCA. So everybody's a little bit different. So it's a conversation we have. I ask a lot of questions about what's important to you. What are you looking for in your plan? And then we go from there. I'll send you some comparisons. We'll talk about it. Ask me questions about it. And you're going to say, yeah. And usually I know what plan you're going to enroll into. I would say 90% of the time I know what my client's going to enroll into because you've already told me. And I can see on this plan you've got a little bit more benefit than on this plan for what's special for you.
Do you have a list of things to pre-fill out before we come in to talk to you?
Yeah, what I do is, I send an email to my clients. This time of year, I send it out to all my clients. I send it back in August. I said, here there are going to be some changes coming up. We don't know what they're going to be, but every year, here's a questionnaire. You like your plan? Yes. You give me a list of your medications and your doctors. I'll review that, If you're happy with your plan, you're good to go for next year. If I find something in there that says, well, you got a medication that's not covered this year, I'm going to tell you and say, here's your other option here, and we need that. Some people will say, I don't like my plan, I want to change. Okay, well, we'll look at, and I'll send you a comparison of 2 or 3 different plans. Hopefully, all of them cover all your medications and cover all your doctors. And then you can take a look at the benefits and the costs within there and say, oh, I think I like this plan. But usually I have a pretty good idea what my client wants based on what you tell me, what's important to you.
Would we make an appointment to meet with you?
Yes, I have business cards up here if you'd like. This time of year, I don't do any in-homes. I'm just swamped with, I have over 600 clients. And so far, I've had over 250 of them ask me for plan reviews. And so I'm pretty much on overload this time of year. But if it's outside of annual enrollment, and let's say you're turning 65 in March, we could make an appointment and come to your home. We can meet at a coffee shop, and we can go over all this. But first I would do is email you the information so you can take a look at it ahead of time.
Do you have an office?
I work out of my house, so no, I don't. Yeah,
So I like to sit face to face with somebody and discuss it.
we can do that. Yes, ma'am.
Do you know of other companies that are pulling out besides Premier?
Regents is pulling out of some counties. In Pierce County, they are eliminating some plans, but they have new plans coming. So if you're on a Regents plan in Pierce County, most likely you're going to need to make a plan change. Pacific Source is left. Humana now is not contracted with Multicare. So, and they have 20,000 patients that aren't going to be able to go to Multicare if they want their Humana plan, or they're going to have to find a new doctor who's accepting new patients. And that's going to be a challenge. I don't know if you've ever wanted to change your primary care doctor and try to find them, but many of them, they call it a panel. Their panel is closed. They just don't have enough time.
Multicare does not have any doctors available, period.
Yeah. Yeah, it's a give and take, on contracts, how much the plans are willing to pay providers. And Humana and Multicare have not been able to come together on that. They might later on. It happens sometimes in the middle of the year with plans, so that can change. But Molina is another one that is pulling out of Medicare Advantage, I believe, in all counties. So there's a big change this year. So that's why I say, look at your annual notice of change document to make sure, or call your plan, or you can ask me. I take care of my clients first. That's what I do every year. Anybody who wants help, I can help you, but it's going to be after I take care of my clients. We'll always get it done, but my clients are what's special to me, and I take care of them first. So I know everybody understands that. Any other questions? Great crowd, great questions. I really appreciate it.
Thank you, Bill. And I would like to just say I've been working with Bill for my personal insurance needs for quite a few years now. And he's helped me through some really sticky situations. And he doesn't charge the clients. He is paid by the insurance companies. So it's a free service, and it's a really good one. We appreciate you.
Thanks, Maureen.
Thank you.
Appreciate it.
So my next step then is to get a hold of you and set up an appointment, or how?
Do you have email?
I do.
Send me an email and just mention that I met you at the seminar,
Yeah.
and I will send you. Oh, hi. I'll send you probably the questionnaire that I sent to my clients, or I might send you an email.